right, so after I inspected the area and there's no masses, there's no visible lesions or scars or any lumps or bumps on his abdominal cavity, I'm just gonna go ahead and listen to bowel sounds. I should be listening at least for 15 minutes on each quadrant. I'm gonna start on the right lower quadrant and move my way around. Okay. All right, so his bowel sounds are active on all quadrants. I'm gonna go ahead and listen for the arteries. I'm gonna be listening for the aortic, which is 2 fingers above the umbilical area, kind of a little bilateral to the side of the umbilical area are the renal arteries, lower to the umbilical are the iliac arteries, and then the femorals are down here. So what I don't want to listen is any bruit, any trills, because that will tell me there is an aneurysm or there can be stenosis on the other arteries. So I'm just gonna go ahead and listen with the bell of my stethoscope. And you should be listening without the clothing, but for patient privacy, we're not doing that right now. I'm just gonna go ahead now and percuss his abdomen. Over the abdominal field, I should kind of be listening a tympanic sound, and then over the organs should be more like a dull kind of sound. So I'm gonna tap, and I can hear some tympanic sound. And if I move here close to the liver, it's more dullness. So what I want to do, since I percuss and everything sounds good, I want to feel for the liver and the spleen. So the liver is right below the rib cage, mid nipple side. So this is where kind of the area the liver is at. And what I want to do, I want to measure the liver, and then I want to kind of do a hooking technique just to kind of feel the borders of the liver. So what I'm gonna do, and I'm sorry my notes are a little long, what I want to do, I'm gonna have you take a big breath, and his ribs are gonna go up, and then I'm gonna scoot my hands under his rib cage, and what I want to feel is for the borders of the liver. So that I can feel the edges. You should be fine to feel some of the edges of the liver. Same technique for the spleen. The spleen, you should not be feeling it. So what I want to do, I want to measure the size of the liver, and for doing that, I'm going to start percussing from the nipple down to where I hear the difference in between the dull and the tympanic sound. Okay, so here it's where my sound changed, so I will make a mark and I will continue through the border, and I will measure the distance of the liver, and the distance is approximately 6 centimeters, which is fine. Again, do the same technique on the spleen. You should not be feeling or palpating the spleen unless there's any disease process or splenomegaly. So with that, I'm gonna move to palpation. So what I'm gonna do light palpation over your abdomen, and then I'm gonna go a little deeper. What I've been kind of touching for, it's for any masses or any abnormalities, okay? So I'm gonna do light palpation. You tell me if it hurts anywhere, and Carlos told me earlier on he doesn't feel any pain in any area. You should ask if there's any pain in any specific area, and then start your assessment on the other side, and kind of be aware of where it's hurting. So now I'm gonna go a little deeper. Is this painful? And I don't feel any abnormalities, and everything, it's soft and it's smooth. All right, so from here, I'm gonna go ahead and palpate for the kidneys. Again, the kidneys are organs that you should not be feeling unless there's a disease process. So for that, I'm gonna do like a duck mouth, and I'm gonna kind of put my hand here and the other one on his abdomen and kind of bring them together and push like this. Is this painful? And you should not be feeling the kidneys. And you do the same thing on the other side. Perfect. So we did check for the kidneys, we did check for the femoral arteries, and we did the full abdominal assessment. Part of the GEU assessment, which we're not gonna conduct here, but I'm just gonna kind of palpate, since we're palpating, I'm gonna palpate for his bladder. So I'm gonna lower a little bit his pants, and you're gonna tell me if you feel any pain.